Hey, Dr. Alan Christianson here with you. Let's talk about how to properly take thyroid medication. So this is stuff that many people do need. Those that lack a thyroid, it's life essential. They would die without that. A lot of folks who are on it may not have needed it, and it may not be helping them. Sometimes they have to get the right amount, the right dose, but in many cases, they had a condition that wasn't going to benefit from medication to begin with. If that might be you, you could take a look at some of my articles on de-prescribing and subclinical hypothyroidism. But if you are on them and they are necessary, there's some good things to take into account. And I'm going to talk through in this video 10 thyroid medication mistakes that you want to avoid making to make sure it works better for you. So the first one is you don't want to get the wrong medication. That sounds silly, but what happens is that pharmacies can quite commonly give you substitutions that are not correct. Now, as a doctor, we can write prescriptions in a couple of ways. For most of the time that I practiced, I used actual paper prescription pads, and then things moved to electronic. But on the paper pads, we had two different spots we could sign our name at the bottom of the prescription. One side said DAW, or dispense as written. The other side said substitution permitted. And what that meant was that was the doctor telling the pharmacist, either if he signed it here saying, I want you to give the exact brand that I prescribed. And if a doctor signed it over there, it's basically telling the pharmacist, you can choose any brand of the same medicine or generic that you feel would be best, most commonly for cost-benefit purposes. So in theory, if a doctor writes dispense as written, it's supposed to be dispensed as written, like for that brand. But there have been some studies done on this, and thyroid medications are very commonly not dispensed as written. And there's debate back and forth, but there's a strong concern that for many people, changing brands may change the efficacy. And what happens there is that the active ingredients are all the same, regardless of which brand you take, as long as it's the same equivalent and the same potency. But the inactive ingredients are not the same, the binders and the fillers. And with thyroid hormones, more so than almost any other medication, there's a lot of inactive ingredients. There's a tiny amount of active ingredients. And if someone doesn't digest them uniformly, they may not get the same effect. Now, that doesn't mean that it wouldn't work, but it means that it would work differently. So if the inactive ingredients in this pill in your body, maybe you absorb 95% of the thyroid hormones, but a different set of inactive ingredients, maybe you absorb 70% of the thyroid hormones. So they both could work. And if you stayed on either, your doctor could look at your levels and make whatever adjustments are needed for it to become effective. But when you're changing from one to the next, it can be different. So this can be going from one brand to another, or if you're on generic medication, this can happen when generics are made from different manufacturers. So if you go and fill your prescription, and up until then, your levels were stable, you were feeling good, and now afterward, your levels are not stable and you're not feeling good, it could be the case that you were either given a generic from a different manufacturer if you were already on generics, or you were given a brand substitute. So if you're having a hard time staying stable, please ask your doctor to prescribe to dispense as written, and then double check once you fill your prescription. Most brand names of thyroid medication, if you look at their websites, they will give you detailed instructions telling you how to do this, how to identify the pill markings, the pill color, the pill size, because they all know this is a problem. They all know that people are commonly bounced from brand to brand, and it's not helping anybody. So mistake number one, don't get the wrong medication. Be aware of staying with your brand, and if you have a hard time being stable, you'd want to avoid generics. Now, mistake number two, don't adjust your pill because you don't feel good. Here's a couple problems with that. Yes, if you're on the wrong amount of medication, it can contribute to a lot of negative symptoms. That's totally true. A couple problems though, one of which is that you can't always know which way the medication is off. It's easy to think, oh, if hypothyroid people can be tired, and I'm tired, I must need more thyroid medication. That's possible. However, it's also possible you need less thyroid medication. Any symptom from too much can look the same as too little, and vice versa. The other problem is that you could be tired for reasons that have nothing to do with your thyroid. And it's possible that more thyroid might mask your fatigue for a while, and you might feel okay. But there's two problems that show up with that. One of which is you're taking too much thyroid medication that's dangerous for you. The other one is that there's some other problem that you're not going to find out about, and it may worsen and it may create other issues. So yes, if you don't feel well, you may need your medication adjusted, but that's a great time to get retested, to talk through your health with your provider, and see if anything completely different could also be a factor for you. Number 3 is don't take your medication with anything besides water. Yeah, there's a long list of minerals, fibers, proteins, compounds that can make thyroid hormones not absorb. So basically anything. You want to take it with water, only with water, not with anything else. Another big one is not to skip days. And this can sound obvious, but if you refill a medication for a 30-day supply, that should last you 30 days. If it's lasting you more than 30 days, it means you're missing days somewhere along the way, and it's pretty common. So some kinds of thyroid hormones take at least 4 to 6 weeks to get a steady blood level, and your body feels best if that's consistent. If you're taking different amounts, different days, or skipping days, it's not level, and you're not getting the chance to respond to it effectively. A lot of systems in your body depend upon adapting to thyroid hormone and adjusting accordingly if the thyroid hormone is too high or low. But they can't do that every day. They take 4 to 6 weeks to adapt to that. So give your body a chance by taking it regularly. You may need a different amount, but you won't know unless you're on it regularly to begin with. Mistake number 5 is don't double up if you miss a day. So if it does turn out that you missed a day, well, slap your wrist and do better tomorrow and stick with it. But 2 pills the next day, that's not going to help. That's going to create a drop off and then a surge. The goal is to keep it as steady and even as possible. Your body makes very slow changes to the thyroid when you're healthy, and it keeps it at a pretty even keel. So if you fall behind, doubling up won't make things better. Mistake number 6, don't break up your pills or chew them. You could think that you're having a problem absorbing them, and it might seem like this would work better, but the difficulty about chewing is that the assimilation timing is off. They won't absorb at the same time frame. Plus, especially if you're on natural thyroid, it's going to taste pretty bad. Now, breaking pills, there are times to where you just can't get what you would normally take in the right potency, and there's no way around breaking a pill in half. It's not ideal, but there are some times where it might be the best solution given all circumstances. If that's the case, use a pill cutter and don't break the pills in advance because you get a lot of little pieces and a lot of big pieces. So only break every other day and to be as precise as possible. But whenever possible, don't do that. If there is a lower potency available, it's better to take more pills of a lower potency than it is to break pills sometimes. Number 7, so after you take those pills, don't eat for that next hour. You need a solid hour of no food, no other pills, no vitamins, no antacids, no medications, nothing for that next hour to let it absorb properly. Now, there's one happy exception to this rule. There's been data about liquid versions of thyroid medication absorbing just fine, even 15 minutes before a meal. If this is a big problem for you, if that hour is a tough thing, you're not alone. Many people struggle with that. They want to eat and go about their day. I get it. It's not an irrational thing. But strong data shows that liquid medication, specifically it's the brand Thyroid is the only one on the market, can be effective even 15 minutes before a meal. Now, related to that, don't drink coffee soon afterward. Now, this is not a never type thing, but if you struggle getting your thyroid to work properly, if you don't feel well, if your levels aren't stable, there are people to where even 8 to 10 hours after taking coffee, they may not absorb it well. So their choices can include just giving up the coffee altogether or switching their thyroid medication to nighttime. That can be a consideration for some. There are also times to where calcium supplements can work in the same way. If they're taken in the hours after a thyroid medication is taken, they could cause it to be absorbed badly. But yes, sometimes things in the following hours also have to be taken into account. Mistake number 9, this might sound funny, but I've seen it happen. don't leave your pills out where kids or pets could get to them. This is also especially true for natural thyroid. They smell like dog treats. And I've had many times where someone said, hey, can I get a refill? My dog ate my prescription. And for thyroid, it's a legitimate problem. Now, thankfully, dogs have a higher metabolic rate and they make more thyroid hormone per body size than humans do. So they're generally not harmed. Little dogs could be. And if it happened a lot, it could be different too. But yeah, better to avoid. And same thing for kids. Now, the way in which it's usually not a big deal for dogs, that's usually a big deal for kids, like a catastrophic, sometimes even fatal deal. So make sure nobody can get into it that shouldn't get into it. And mistake number 10, when you're testing your thyroid levels, test your levels before you take your pill, not afterwards. We call this the trough versus the peak. Any medication that you ingest and you test the levels of, there's going to be a high point and a low point, the peak and the trough. And thyroid medication, the normal ranges are set for trough levels. After you take a dose the following hours, your levels are higher, but not in ways that are consistent and not in ways that are predictable. So if you're having a hard time getting your scores right, be sure and take your pills after your blood tests, not before. So how to take your medication properly? Here's the routine that I encourage. And there are times where doctors may suggest other versions of this, and by all means, listen to your doctor, but the default protocol is first thing in the morning, right after you get out of bed, and a solid hour before you're having anything else. You want to confirm the brand and the dosage with both your pharmacist and your doctor and yourself. Look at an actual picture of what the pills should look like, their size, their shape, their color, any markings. So I talked about not letting kids and pets get into it, so bear that in mind. But if those things wouldn't be a factor, a really helpful ritual is to put your pill out inside the cap when you go to bed. What the reason for that is, you can take it if you wake up in the middle of the night. It's a great time to take it. But you might not be sure if you did or not. But if you put it in the cap, you'll know it's gone. So the cap, most medication bottles you can unscrew and invert, and you've got a little cap there. So yeah, put the tablet in the cap when you go to bed, put a glass of water next to it on your nightstand. If you wake up at night to go pee, or when you wake up first thing in the morning, take your pill, wash down with your water, and then let that hour timer start ticking. Do some light exercise, take a shower, use the bathroom. You can rack up an hour. Once the hour is passed, your other things are fair game. The food, the coffee, the supplements. If you can't get dialed in, consider the coffee, the calcium as possible issues afterward, but in most cases they're not a big factor. But that's the main ritual. So Dr. C here with you. There's 10 ways to take thyroid medications properly and avoid making mistakes with it. All right, take great care. Bye-bye.